If you've picked your Medicare plan arrangement, but now you're starting to second guess your decision, you may have heard the warnings that you're stuck with whatever plan you pick first. With any normal product or service, you can just return it or cancel it and pick something else. However, when we start talking about Medicare, and more specifically Medicare Supplement plans, that logic gets thrown right out the window. It's not always easy. In fact, at times it can feel downright impossible. But in this video, I will show you how to switch from whatever Medicare plan you are on over to a supplement plan. And before I get into the best ways to switch, I have to warn you, supplement plans are not for everyone. If you are on Medicaid, it is illegal for us to recommend a supplement plan, and we get secret shoppers all the time trying to lure us into that conversation. If you are on Medicaid, you can have either original Medicare only, together with your Medicaid coverage, or there are Advantage plans specifically designed for those who qualify for both Medicare and Medicaid called Dual Eligible Special Needs Plans, or DSNPs. But if you ask us for a supplement plan or any other agent, our red alert sirens start ringing because we cannot offer you supplement plans. For everyone else, let's talk about switching to supplement plans. And the big difficulty here revolves around the fact that with supplement plans in most areas, if you don't go on one at the right time, you will need to answer medical questions where you may be charged higher rates if your health isn't great, or you may be denied altogether and you cannot get a supplement plan. So let's tackle that. This video is split into two different parts. The first part is switching from an Advantage plan to a supplement plan, and then the second part is switching from a supplement plan to a different supplement plan. At the very end, I'll give you some insight into the medical questions and what to be aware of there. So for part one, if you're on an Advantage plan and now you want to look into going back to original Medicare and a supplement plan, here are your options. The easiest route is for those of you who live in 4 special states. Connecticut and New York have year-round guaranteed issue open enrollment, meaning you can move to a supplement plan with no medical underwriting or fear of denial or penalized rates. Vermont is sort of in this category as well. Not all insurance companies in Vermont are required to follow this, but many do. Massachusetts is the last state that is in this special category. Insurance companies are required to offer supplement plans as guaranteed issue from February 1st through March 31st every year, with many insurance companies still offering guaranteed issue all year round. Those are the easy states. In exchange for this freedom to switch, you are also experiencing some of the highest, if not the highest, Medicare supplement monthly costs in the country, so there is a trade-off to this flexibility. Well, what about the 90% of US citizens who do not live in these 4 states? Let's move on to the other more simple ways to switch to a supplement plan. And the next 2 switching tips involve timelines, more specifically, a time that is referred to as your trial right. And we have to be specific here. The first trial right is if you choose a Medicare Advantage plan when you first became eligible for Medicare, meaning at 65. If this is you, you have 1 year to try Advantage plans. And if within that year you want to switch back to original Medicare and a supplement plan, you can do so, guaranteed issue, no fear of denial. If you delayed Medicare past 65, for example, you continued to work or your spouse continued to work and you were covered by the employer plan, so you take Medicare after 65 and pick an Advantage plan first, this rule no longer applies. And if you were to try to switch to a supplement plan in that first year, you could be subject to medical underwriting and potentially see higher costs or be denied. The second trial right is if your first Medicare selection was a supplement plan, and timing doesn't matter here, meaning if you went on Medicare at 65 or if you went on Medicare after 65, as long as you chose a supplement plan first and then you wanted to try an Advantage plan, you have 1 year to try that Advantage plan and switch back to the same supplement plan you had before if that insurance company still offers it. Guaranteed issue. And this is only once. You can't jump back and forth with this one. It's a one-time deal here. So those are the 2 easy ways to switch, but they are dependent on timing. Now we have 5 more ways to switch from Advantage to supplement plan to finish out part 1. 3 of them are related to one another. One way is always available but not guaranteed, and the last one is kind of a trump card way to switch if you need to. Okay, the 3 related reasons are all easy to accomplish, but the circumstances in which they would happen are more rare because they all involve your plan leaving your area or going out of business. If the Advantage plan you have leaves your coverage area or they leave Medicare altogether, you can now move to a supplement plan guaranteed issue. We actually experienced this locally with 2 plans this year. They shut down and left the area, so all beneficiaries on those plans could move to a supplement plan if they wanted to. They don't have to, and they can pick a different Advantage plan if they wanted, but they also have the option to go to a supplement plan with no medical question. Similarly, if you have original Medicare and an employer group health plan, this could include retiree or COBRA coverage or union coverage that pays after Medicare pays, and that plan is ending, you can pick up a supplement plan guaranteed issue. Finally, if you leave a Medicare Advantage plan because the company hasn't followed the rules or it misled you, you can switch to a supplement plan. Now, you would need to prove that they haven't followed the rules or they misled you with actual recordings or emails or messages, not simply saying so without any evidence, and you would submit this complaint to Medicare. So if any of those three things happen to you, switching isn't hard, but again, those circumstances don't happen very often. Okay, one option that is always available to you, and the difficulty will depend on your health, is by answering those medical questions. If you can pass, you can move to a supplement plan. Certain circumstances will warrant the insurance company charging you higher than normal rates. Still, other circumstances will cause the insurance company to deny you completely, and I will cover this at the end of this video. The timing of this step is important because bigger picture here, you are moving off of an Advantage plan that likely has Part D coverage included, and you can't just pick up a Part D plan anytime during the year. So you will want to time your switch in accordance with the enrollment periods where you can pick up a Part D plan as well. Specifically, the annual enrollment period from October 15th through December 7th, or the open enrollment period from January 1st through March 31st of each year. So if you're going this route, the first thing that you need to do is make sure you pass the supplement plan medical underwriting. Don't cancel your existing plan yet. Do the supplement medical questions step first. Then you would need to pick up a Part D plan. When you sign up for that Part D plan, once it goes into effect, it will automatically cancel your Advantage plan. This means that what you do not want to do is start the Part D process first, sign up for that plan, go through medical underwriting for the supplement plan, but then you get denied, and then you have your Advantage plan canceled because you got that Part D plan, and you also do not have a supplement plan. That is bad news bears. Use your agent here. It doesn't cost you anything. If you don't have one, we can help you find someone else. Just use an agent. Okay, the last way to switch from an Advantage plan to a supplement plan that I'll cover in this video is that trump card that I mentioned earlier, and that is to move. If you move outside of your plan's coverage area, this qualifies as a special election period where you can pick up a supplement plan. It has to be outside your coverage area, and in some instances, this may mean you're moving out of your state. In other circumstances, it could be moving to a different county. This all depends on the insurance company and the plan you have and where you live. Okay, this is the end of part one for those of you interested in switching from an Advantage plan to a supplement plan, which is just half of the conversation. Many who go on a supplement plan end up changing their minds about the plan letter they choose or the company managing their plan, because as we discussed in several videos, supplement plan premiums, they increase over time, and some plans and companies increase more aggressively than others. Or they went with a lower coverage plan letter and now they want to switch up to a higher coverage plan. So here are the ways that you can switch from one supplement plan to another, and fair warning, states have their own rules about this. So we'll start with kind of the national rules here that are more standard, and then we're going to go through a few state-specific rules. The first general rule is if your supplement plan company goes bankrupt and you lose your coverage, or your Medigap policy coverage ends in some other way through no fault of your own, you can switch to a different supplement plan with a different company. Similar to one of those Advantage plan reasons, if you drop a supplement plan because the company hasn't followed the rules or it misled you, you can pick up a different plan with a different company. Same as earlier, you would need to prove that they haven't followed the rules or misled you with actual recordings, emails, or messages, not simply saying so without any evidence. Those are the only two standardized rules here. Notice that you moving isn't one of those. Supplement plans do not have a coverage area. They can be used anywhere in the country, so simply moving doesn't always guarantee that you can switch to a different plan with a different company. The rest all get into specific states, so you can see if your state falls into one of the more flexible arrangements for switches, and then I'll wrap this up with some final important circumstances like those medical questions. The first 4 states we've already discussed. The same rules that applied with Advantage plans apply here as well for supplement plans with Connecticut, New York, Vermont, and Massachusetts. Connecticut and New York are open enrollment all year long. Vermont and Massachusetts have many insurance companies that are also open enrollment all year long, with Massachusetts having that window from February 1st to March 31st, where all insurance companies must have that open enrollment window. Sticking with our northeast corner of the country theme, in Maine, you can change your plan to one of equal or lesser benefits as long as you haven't had any gaps in coverage longer than 90 days since you first signed up for a supplement plan. Also, insurance companies in Maine must offer Plan A to anyone who applies for Plan A during a 30-day window each year. The insurance companies themselves can choose which month that they want that window to be in. Now we're going to fly all the way to the northwest corner of the country to the state of Washington. In Washington, if you have a Plan A, you can switch to a Plan A with a different carrier without underwriting, and someone with a supplement plan letter from Plan B all the way through Plan N can switch to another Plan B through Plan N. This applies year-round as long as you have been covered under the supplement plan for at least 90 days. Next, we have Missouri. Missouri has an anniversary rule. You can change your supplement plan once per year on its anniversary. This means on the original date when you got the supplement plan, you can switch to a plan of equal or lesser coverage with a different company. This lets you shop rates to see if they are lower with a different company. Your window to switch starts 30 days before your anniversary date, and it ends 30 days after your anniversary date. So you have about a 60-day window there. Now, there are 8 states that all have some form of a birthday rule. The states are California, Idaho, Illinois, Louisiana, Maryland, Nevada, Oklahoma, and Oregon. The rules are all similar, meaning that during a window of time surrounding your birthday, you can switch from one supplement plan to a different one of equal or lesser coverage. Going from a plan G to a plan G with a different company, that's okay. This is equal coverage. Going from a plan G to a high deductible plan G is okay. That's going to lesser coverage. Going from a plan N to a plan G, that is not okay because a plan G has more coverage than plan N. Some of these states have windows of 30 days, others have 45 days, others have 60 days, but the point is they have a birthday rule. The one standout to keep in mind is Illinois. This is only allowed for those younger than age 75. Once you hit 75 years old and higher, this flexibility goes away. If you live in a state that I didn't mention, well, you don't have the same flexibility and rules around supplement plans, and you're left with the first 2 standardized rules that don't happen often, but you still have options because for insurance companies outside of those states we've mentioned, the insurance companies control their enrollment rules. Most will require medical underwriting. However, I live in a state that does not have any of those fun freedoms, but we do have one insurance company that will accept people coming onto a plan of equal or lesser coverage with no underwriting. They are an exception. In fact, in our state, they are the only one that does this. There are others in other states, but I wouldn't count on those, and given their flexibility, their rates may not be as competitive. The last thing to cover here would be medical underwriting. This is always an option for you. You can take the risk, fill out the medical questions, and hope you get accepted. Many insurance companies have knockout questions, meaning if you answer yes to things like kidney failure or inpatient hospitalizations within a certain window of time, cancers, immunodeficiencies, scheduled surgeries or evaluations, or treatments that you have not completed yet, or you're waiting on some diagnostic testing or other more serious conditions, they will automatically deny you. Insurance companies have other criteria where they won't automatically deny you, but you could see a higher than normal cost. Think heart disease, diabetes, liver disease, ALS, MS, Alzheimer's, dementia, and Parkinson's, tobacco, alcoholism, drug abuse, and others. The nice thing is that many of these companies have these sections of questions in their application that will tell you, hey, if you have these, you're going to be denied. If you have these, you will see higher rates. If you don't have any of these, then we'll probably be good. It's important to understand that lying on these questions will not help you. If you lie on your medical questions and it's later proven to be a lie, it's not going to be great for you. They are going to ask your providers and they will follow up with your providers. And if you and your providers are lying, well, that gets into fraud territory. And on the record, off the record, all records, do not commit fraud. So just tell the truth on these questions. Work with your agent to go through the underwriting timing and the supplement plan and the Part D plan and canceling the Advantage plan. Now, right over here, a video is going to pop up, and YouTube has picked this video just for you because it knows that you would really enjoy it, and I have to agree. So hopefully this video helped, and I will see you over there.